Hello. Hello, should we be recording now? Because we're testing. Hi, Dina. How are you?
Hi, very good. Hello, I can hear you. Okay.
Good. I'm wondering if we should still be live on YouTube because we are testing.
Is it live?
Yes, hers is live. The screen this is what the people are seeing exactly.
So people can see that.
Yes.
Can you turn it?
شايفني عادية؟
لا, she has to.
Yes, she has to close her hand.
Okay.
But can we test it here, please?
This was Tara.
It's good. We're testing the.
I think you want me to receive you downstairs?
Mario, how are you? Very good.
Okay, we can see her.
When you are here, let me know.
I'm gonna take it.
No.
Our original
Okay, can we test the sound, please?
Unfortunately, she wasn't able to join. It was last month.
Can you test audio? Test.
Can't hear her here.
She really got excited. بس ما هي شو السر اسمك ما
Can you hear us? Stefan.
I can hear you. I want to test my audio. Can you hear me?
Can you hear us now?
I can hear you. Can you hear me?
You can hear you.
Okay.
Can we hear her from here? Please speak up.
I will ask you. This time.
Thank you.
There are speakers. There is sound from the screen itself.
Hello, how are you?
Can you able to hear us?
Yes. And you bring like a woolen
عليا سامعتينا؟ طب بصير تحكي شيء؟
Yes. Test. Yes.
كيف سامعينك منيح؟
Okay. I think though there's going to be echo. So while I speak, maybe you should mute the mic on the device.
في شوية lag صح؟
This is lagging very bad.
What?
Zoom is lagging.
Zoom is lagging.
The issue with the connection that we have, the internet connection. Dina told me we have the best connection. Yes. So there should be something else.
Is your connection good?
Ali, is your connection good?
I have a very good connection. There's no problem with lag. The only problem would be echo. So if you mute your device while I speak, that would be the best way.
Exactly, yes.
خلاص.
The problem here is.
So I can test now. Testing sound now. Can you hear me? Thumbs up if you can hear me. Okay, good. And I can't hear any echo, so I could just do my opening notes and then you can unmute if you want to. I don't know how is the feed for the live session coming from the Zoom as well? So would people be able to hear me over the Zoom if they're watching remotely? You are muted now.
Close the camera, Alia.
Mute.
Okay, good. خلاص. We will mute from our side, Alia. Once we are ready, we'll let you know.
Okay, but remember you're muted, so you have to tell me somehow. Okay?
No worry. We'll text you. We'll send you WhatsApp from Dina.
We have a chat already.
Okay.
panel discussion, Shaping Health Supply Chain in the Post-Pandemic Future. A joint panel discussion by Health Logistics and the International Humanitarian Institute of Dubai. This is Farah Mouaddi from Health Logistics Middle East Office. I would like to thank you all for joining us today. We will start our panel with few words from Alia Barade, Health Logistics Middle East Regional Director. Hi, Alia.
Hello, and I would like to thank the attendees and the panelists for joining our joint panel with the International Humanitarian City in Dubai. Thank you. Thank you for joining our panel jointly with the International Humanitarian City in Dubai on the future of the supply chains post-pandemic. Health Logistics understands the potential investment in supply chain preparedness and the challenges that exist. As you know, we contribute on trainings, outreach, workshops, and data analytics to support our partners and donors select the right preparedness measures, get the funding to implement them, and measure their impact. For the last 5 years, we have been in a successful partnership with the International Humanitarian City doing just that. Jointly, we have revealed that the sector needs standardized tools and models, enhanced coordination, and workforce upskilling. This is why it is our ambition to bring about a center of health excellence housed at the International Humanitarian City in Dubai around the pillars of education, operational excellence, and innovation, and collaborative platforms as well. We are hoping to set the standard of excellence in health logistics through partnerships with governments, NGOs, academia, and the private sector. And this is exactly where our panelists hail from today. We are hoping that this would be the first of a series of discussions and panels that open the conversation on the topic of health logistics and health preparedness, and that the resulting collaborations would build the case for our Center of Health Excellence. Thank you again for being with us today. I just wanted to give a few opening notes, and I look forward to enjoying the panel discussion.
Can you hear me very well? My voice is good. Okay. So, health logistics understand the potential of investment in supply chain preparedness and the challenges that exist. That's why we contribute to trainings, outreach workshops, and data analytics, support partners and donors to select the right preparedness measures, get the funding to implement them, and measure their impact. For the past 5 years, we have had a successful partnership with the International Humanitarian City doing just that. We revealed the sector's needs for standards models, enhanced coordination, and workforce upskilling. This is why our ambition is to bring about a health of center excellence housed at the International Humanitarian City in Dubai around the pillars of education, operational excellence, innovation, and collaboration platforms. We are hoping to set the standards of excellence in health logistics through partnerships with government, NGOs, academia, and private sector. And this is exactly where our estimated panelists are from. We are hoping that this would be the first of a series of discussions and panels that open the conversation on the topic of health logistics and health preparedness, and that the resulting collaboration would build the case for our Center of Health Excellence. Thank you, Alia, again for your introduction. Now, allow me please to welcome our panelists in the room. Mr. Giuseppe, International Humanitarian City CEO, thank you for joining us. We know you're always busy, and thanks for taking the time. Francis from our Africa, Dr. Melina Stephens, Professor of Innovation Management, School of Government. Thanks for joining us, Dr. Melina. Mr. Mario Stefan, Doctors Without Borders. Mr. Mario, and last but not least, Mr. Jadid, PA from Aster. Responsibilities Aster DM Healthcare. Thanks for taking the time. So today, we hopefully during the panel, we reflect on the COVID-19 response, what were the success stories, the main challenges, and what is the way forward to strengthen health supply, health logistic preparedness in the Middle East and North Africa. We would like to try to explore the answers to a central question, and how can we build more resilient health supply chains that would enable us to respond to any potential large-scale outbreaks, health emergencies, or pandemics in the future. Hopefully we'll get you excited, and we'll try to find answers for this important question. Let's start with the international humanitarian system. Now, during the last 2 years, the international humanitarian system and its members provided support and relief for more than 119 countries, with the 1,020 above 1,000 shipment dispatches, and a totaling a value of above 98 million USD. So, Mr. Joseph, I would like to hear from you more about the role that the ISC played as a humanitarian logistics hub in supporting its members and the humanitarian community in responding to COVID-19. What were the major services and support that you provided for the members, and how did it look like?
Thank you. Thanks, first of all, for inviting me today. And let's start from rectifying some figures. In the past 24 months, means 20 and 2021, the community of the international humanitarian city responded, yes, with an average of 1,200, 1,300 shipments per year, and serving and going into more than 120 countries, but with an average of humanitarian aid, which were valued above the $130, $140 million. Of course, I can tell you that, especially in 2021, approximately the 80% was destined to population affected by the COVID, which means that the other 20% we try to not be behind anybody by assisting also on other emergencies. And the same happened in 2021 with a slight decrease of the aid which were sent on for the assistance of the government. What we did as ISC, well, we tried to move ourselves into 3 areas of assistance, or in 3 areas of support for our community. First of all, the most simple support that usually the community used to ask whenever it's affected and shocked by financial conditions and so on. That here, Khaled, who was together with me when we brought into the board of directors the request of trying to waive some fees for, because our community was struggling on the financial condition. And this has been done. Then there is an operational support which we did. Obviously, that everybody here, we are quite well prepared on logistics, and we know very well that the logistics supply chain was substantially collapsing, progressively collapsing, because initially we were convinced that it was a Chinese problem, then we were convinced that it was an Italian problem, and finally we realized that it was in reality a world problem when Dr. Pedros declared the pandemic. Now, on this one, of course, the collapse of supply chain, which counted almost all the aircraft, that was our first reaction. How went the humanitarian community? So we got, for example, a permanent aircraft, military aircraft, which was based together with the World Food Program in Europe. Then we got other military aircraft for conducting specific operation, moving stocks from Dubai. Then we solicited from one side the private sector, and later on the private sector came to us on how to support the humanitarian community. Let me say that we were so good from one side, and to get also a good chance of getting the mobilization of the private sector, especially, let me say, the logistics excellence of Dubai. I'm talking about not only Emirates Sky Cargo, I'm talking about the Balaxian Logistics Alliance, talking about all of those that all the consortium in Abu Dhabi. So was there a huge movement from the private sector? And this, I believe, that really was the big support. Then there is a third one, which I would not call support, but honestly, I was provoking, and I will continue to provoke. Lessons learned. I would like to get lessons learned from this pandemic situation. I'm not going to say that we were totally unprepared. From one side, everybody remembers Bill Gates, who was in single year next to be the pandemic next to the pandemic arrived. Now, why we were unprepared, considering that a few years ago we were fighting with Ebola, many years ago we were fighting with the avian flu and so on. And when we opened the warehouses, honestly speaking, when we go and look in terms of personal protection equipment and so on, we are not absolutely prepared. And why I'm insisting on the lessons learned, and I will continue to provoke for the rest of my life, because now we have the risk of entering into the same situation with the current Ukraine crisis, where out of the blue, we are not going to get enough preposition in order to support.
I totally agree. So I guess we need to learn from this experience and keep sharing the knowledge and building on the experience that we have, hopefully to be more prepared in the future for the coming process of pandemics. So let me go to Mr. Mario. Mr. Mario, can you give us your perspective from a humanitarian point of view as MSF was on the ground responding during the last 2 years? What were the main challenges that you faced? And how were you able to provide protection, PPAs, while also vaccination campaigns, in addition to ongoing health programs? Please tell us more. How was it on the ground?
Thank you. I think just to start, I think it's important to keep in mind that this is, for us at least, this was not the first pandemic we were dealing with. So maybe to Mr. Saba's point earlier, we were not entirely unprepared. And as far as we were concerned, we thought we were fairly prepared. But nobody expected the magnitude of the crisis. And I have to say that, first of all, considering that the pandemic is not over, contrary to many beliefs, each year of the pandemic since 2020 has been a bit different for us. So I want to say that we kind of went up, and I'll take you through it very quickly, managed to get some kind of cruise control, and now are cruising at a regular speed, more or less ready for any uptake or any downtake. I think initially the MSF had three main challenges. The first challenge is we want to keep everybody safe. And everybody is our staff, is our patients, is people we're interacting with, people we're working with. And that was having ample PPEs on site, having all the protocols and the procedures in place just to make sure that everybody was okay. And everybody being okay means also having all the systems in place to get people out, isolate people, replace people. And obviously, when the borders are shut and when there's no more flights and then when there's no more transport, there's no more access, it becomes a bit more challenging. But that was basically, I would say, the first challenge we took on board. The second challenge was to maintain our existing activities, because unfortunately, in wars and situations of conflicts, of natural catastrophe, or sanitary deserts, the fact that there was a pandemic didn't stop those conflicts, didn't stop those catastrophes from occurring. Women still had to deliver, were pregnant. We still had kids that we had to take care of. There was still a whole range of programs. Nothing really stopped. I mean, we have different pace depending on where you were. Patients were not able to move anymore, and we had to reinvent ourselves in some context. But that was, again, a very important challenge we had. The third challenge was to treat COVID and to treat people victim of this virus. And that means two things. That means, first of all, being able to develop those programs. So when you're working in a war-torn country, when you're working in a place like Yemen, for instance, and you need 8,000 liters of oxygen per day in one particular location where we're working, this is not something that you have in the hospital where you press a button and then the supply of oxygen is coming. This is something that you need to be able to secure and to maintain, and there's a whole process and a whole system that needs to stay in place. But at the same time, as you develop those COVID response activities, you need to make sure that in parallel, people are not afraid of a patient coming to a hospital on suspicion of COVID, to have really delimited and separated areas to be able to welcome, treat, test, what have you. So those were those big three challenges. Now, from a logistics perspective, what did that mean? It meant, first of all, that we were all, like a lot of stakeholders, or a lot of partners, or a lot of colleagues or counterparts, we're all looking for PPE. And it was a big mess back then. I'm sure those of you who will remember 2020 will remember stories of cargo being swapping hands on the tarmac as it's about to be loaded because somebody arrived with a suitcase full of cash. Some countries taking hold of PPE, transiting through those respective countries and putting their hands on it, although, bordering on the illegal, et cetera, et cetera. A lot of questions going on. So it was really a bit of a unique situation. And what did it show? As far as we're concerned, it showed how important it was to diversify our supply chain and how important it was to diversify our procurement. And our organization, for many reasons, good and bad, I would say, remains today maybe a bit too centralized when it comes to its procurement, and not as diversified as it should be when it comes to supply chain. So again, talking about lessons learned, those are the two main lessons learned that we want to put on the table. Location like Dubai, I won't repeat what Mr. Salah said about all the facilities and the logistics hub and the added value that we have here, but also happens to be, in a way, at the center of the planet and giving us the opportunity to diversify those circuits and develop them and change them. What then happened was, for us, a big issue around quality control, because despite the fact that it was difficult to secure supply and it was difficult to get our hands on PPE in that case, there was also a big challenge then of determining what quality was acceptable, what quality or what minimal quality were we willing to accept outside of our usual protocols, and where to test all that. And that was a very big challenge. So you deal with that situation to then arrive at a place where our organization had COVID activities in 100% of the locations where it was working, including locations or countries where we open COVID-specific activities. And today, we don't talk about COVID in the sense that COVID or COVID response or COVID activities have been fully integrated into all our other activities. So I think we've kind of reached that balance today where, okay, if we're going to have an uptake, if there's going to be a variant of concern, if the health situation in a particular location where we are working will be affected by COVID, we've been able, after 2 years at least, to put in place a system to address that, and again, keeping everybody safe, making sure that those patients are attended for, and making sure that our other activities continue to happen. So I want to say, really, those three challenges are challenges that remain. One very important aspect, and that did wonders for us, was the collaboration with different stakeholders left and right. I mean, had it not been, and I recall because I was personally involved in it, had it not been for WHO back then, 2 years ago, who was able to loan us on a very, very short notice a certain number of masks that we were able to dispatch on locations where they couldn't yet, or they were, focusing on other locations. And there was a lot of planning involved, but the possibility of really putting our hands together, and from a discussion in Dubai to a formal discussion in Geneva, back in Dubai, being able to rely on each other, and then us securing the quantities and then being able to replace their quantities, which came in need. And that's one example that I can put on the table, but we have many examples around the globe of this collaboration that really highlighted two things. One, we all, as a health organization responding to this pandemic, we all had our different speed, we all had a different reality, we all went up, but not necessarily at the same time when it came to our volume of work and activities. But we've managed to balance that because there was very strong coordination, there was very strong collaboration, regardless of how unique or specific our different mandates were. So again, for me, in terms of lessons learned, let's be more diverse. Let's look into alternatives, because I personally think that it's going to be very difficult to mitigate in the future, or would a situation like that happen again, there will be, unfortunately, in my opinion and out of experience, very little lessons learned. So the best lessons learned are the ones that we apply to ourselves and that we put in place, and hopefully with as many people as possible around us.
Sure, thank you. So it's all about collaboration and sharing knowledge and resources in order to respond and be able to act as quickly as possible.
In due time, anticipating this as much as possible.
Yeah, let's make sure we will do this in the future. Okay, Mr. Bradley, as a leading international logistics company, would it be great to hear from you about the industry in general, and for Kuehne and Nagel Pharma vertically specific? What were the capabilities before the pandemic, and how did you guys adapt to the increased demand and the disruptions all around you? Please let us know how did it go with you.
Perfect. Farah, thanks very much for inviting us, not only for the discussion, but to do it at Expo is quite exciting. We started our business in UAE in 1978, so our roots are intertwined with those of the UAE, and we see the importance, and we're very excited to be here. With regard to the update, the global supply chain was severely disrupted. It started with the pandemic and passengers being able to travel. It then moved on to the Suez Canal blockages. It went further down to the Ukraine-Russia crisis as we see it at the moment. I think that if I had to give you a market update on all modes of transport, we would be here until this evening. So if anybody does have any questions, please reach out to me after this, and I'll more than happily share some information with you. With regard to the adaptation, there was 3 simple rules that worked for us that came, and I think everybody's spoken to the same rules as we sit here. It was planning, partnership, and communication. When looking at planning, so there were various stakeholders there. There were ministries of health, there were freight forwarders, there were carriers, there were NGOs, there were manufacturers, there were distributors. And what we found at the beginning of this journey is we didn't know what we didn't know. Everybody had snippets of information and everybody had expertise in different fields, but the one thing we realized very quickly that a global solution was needed to a global problem. We needed to hold hands, we needed to walk the same direction, we needed to share information. From an infrastructure point of view, obviously with the logistics side of things, infrastructure was a huge challenge. So not only did we need to figure out who had the infrastructure required for the temperature controls, for the GDP transport, because quality still remains important, even though the volumes pick up as dramatically. I can remember conversations at the beginning of the pandemic that everybody thought that every aircraft at the sky was going to be full with vaccines. We didn't know what the packaging looked like. There were no vaccines, so we didn't have any information, and we needed to start finding out what we could do. From a partnership point of view, we really found that the walking the same road together worked. We've had huge success with the NGOs signing memorandums of understanding between carriers and suppliers. So where we weren't involved in any of the movements, we were still involved in the facilitation of the discussion. And most of all, what we needed to realize is that we had one common outcome. The goods needed to be on time, at the right place, and a vaccine is pointless without a syringe. So we needed to make sure that the PPE was there. We had huge success bringing vaccines from India via Dubai and meeting up with PPE in Dubai and consolidating onto the same aircraft out. There were 3 freight forwarders involved, 3 carriers, 2 NGOs, and then that was just all in one shipment, which we found, and we never had a single delay, which was a real feather in the cap of the industry. With regard to communication, like I said, we needed to be talking early and we needed to be talking often, and I think this is the lesson that we need to learn, is we need to be having conversations about what could go wrong or what could be a solution. We don't need to wait. Traditionally with freight forwarding, we had specific cargo that's needed to get, there was a specific partner pairing of the origin and destination. Whereas with humanitarian and with COVID specifically, we didn't know where it was coming from and where it was going to, but we needed to create a solution in the background, which we did quite successfully as an industry. The one thing I can say is that at Kinderhook, we're really proud of the fingerprints that we put onto the vaccines that have run around the world, and the fact that we can sit together in a room and have a meeting like today because of the solutions that the people in this panel have provided. And last but not least, I would definitely have to say that when I used to go to a dinner party as a freight forwarder, and we'd have a discussion about what we did for a living, supply chain guys were always, oh, okay, we'll talk to the doctors, we'll talk to the lawyers. And that has completely changed. Yeah, not anymore. It's completely changed. It's now interesting, it's now sexy, and the world now knows what we do. And I think that the main thing that we should be doing is we should be taking people from a different demographic that are now interested in logistics, putting them into what we do, because COVID definitely taught us how to change our minds about how we do things. So I do think with the different kind of people that we could attract to the industry now, whether it be through the NGOs, through the supply chain, through the freight forwarders, I definitely think by nurturing that and building that we would be able to have solutions in the future.
Perfectly. So now the people are more, the world is more aware of the importance of supply chain, and we need to work more on capacity building and training, and have highly qualified people to support in the humanitarian sector and the supply chain as well.
Exactly.
Thank you, Mr. Gavin. So now we're going to Mr. Jalil. As Astor covered the full spectrum of health services, can you give us an insight from health delivery side, including hospitals, pharmacies, and the academia? What was your role in supporting the humanitarian sector, responding to COVID-19, and how can you provide further support to enhance the humanitarian and health supply chain and responding to COVID-19, please?
Sure. Thank you, Ms. Farah, for considering in this such a productive and good discussion. Being in healthcare, so we feel that, like we had to look at it more into a comprehensive way. So beyond the supply chain issues, so it started from a challenge when it happened in China. So that immediately we got the pulse in Kerala, where we operating in India, the southern side. That was the place in India itself. It happened first, even before it had a big hit in Dubai. So it was a small case. We managed it, so that helped us to have sort of a preparedness. So that was the most important thing, and then to increase the awareness among the public. So in the initial days, we were going into the labor workforce here in the JAPSA, in the industrial belt, and many places where there were a lot of consignment and movement, and along with the DHA. We were educating the people how to prevent it, or more awareness about the diseases, so together we were doing it. And the third important thing was, it came a day, it was more of like a shutdown, and then, the numbers were increasing, and people were more concerned what happened in the Daira side, So it was almost like a shutdown. So no one had the courage to come forward and do something. So that time, DHA, Dubai Health Authority, Dubai Police, Dubai Ambulance, RTA, and Aster, we came together to see that the night market is clean, closed, and then the entire area is evacuated, and then we have ensured that those people are either transported to places like Warzan, where we were playing a strategic role along with the DHA to establish the first of its that model, what I call that isolation center over there. So there also we understood the value of working in a collaborative way, rather doing it all by ourselves, what our chairman and the whole senior management has done. So we have shown a model, and then we have duplicated it, but at the same time we have encouraged other players also to come work together under DHA governance, which made a more sustainable way of working. There came the challenge of again
within our operational level as well as in the social front, the challenges of logistics, which is the topic which we are talking, the availability of the materials, whether it's our own or even the consumable PPEs and all. So as a responsible retailer, Aster Pharmacy, we have our own logistics hub and all here. So warehouse, we were very particular to not to trade or to make the market moving with the cost escalation. So that part we were taking care of. At the time, we had to be very adamant in cutting this middleman and then the price going up, or even to stand with the government to bring in sort of laws, not to prices overshooting. Like that was another important role we could play. So then again, the awareness has gone beyond the level. Then the screening side, it helped both in the preventive, otherwise in the curative way. We've been into different places with the police and all. Then among that, the other important thing which we found the value we could add to this country or in this region is, with the acute shortage of manpower. A team of nurses were brought from India where the COVID hit was not that big at that time. A flight full of nurses were brought and with the support of DHM and special arrangements, and they were not working for us. In fact, they were distributed to other private players as well as to the government mechanism here. So that was another steps we could do it. And then we had to get involved in giving some food distribution, PPE distributions, or even going beyond the geographies to see how we can add value into sort of an aid programs and also. So for us, again, the mission is not over. So even some geographies, for example, we've been to Sudan. We have mobile clinic running here in Dubai. At a time, we had to even transport along with the patients, positive patients, along with the Dubai ambulance. So places like Ethiopia, which is again another hub. So we were educating people through a mobile clinic, more of like an awareness going door to door. In Sudan, it's like even now we are the people who are along with the Ministry of Health distributing the vaccine in the northern front of Sudan and all. So Yemen also we got involved with because it is not only the COVID, even the war, all they put it into a sort of a difficulty. We took a mission of 75 tons of food taken to what I call Yemen and got it. So I'll tell you one thing. So all those made successful because of a collaborative working partnership. And we are more than happy to say and loudly to public, yes, it is because of the IHC. We are registered our Aster DM Foundation and the guidance and support they have given to us. And that same thing happened when a 2 million dirhams worth of aid, when we mobilized to state government Kerala's request, it was again sourced by a lot of people came together. We leveraged our what do you call the procurement and then the logistic capacity because individual donors came, we did not touch any money and we just leveraged our capacity of the procurement and we ensure that everything is mobilized to IHC and with the IHC support through DHL, Air Arabia, Emirates Sky Cargo, this was shipped successfully to India and then the government offloaded all the tax and all exemption, made us to install it on timely to avoid another spike or even a preparedness, that way the capacity building also we could play. So these are some of the roles we played.
Thank you. Sure. So as mentioned by the previous speakers, it's all about communication, and I like also that you mentioned about being responsible and looking at the full picture and trying to maximize the benefit, and also build capacity in the local areas and to try to help them to have a sustainable impact. Definitely. Thank you, Mr. Jamil. Now, Dr. Malakina, here comes the role of the academia and innovation. How might the health system benefit from this intersectoral collaboration and knowledge sharing among the different stakeholders? Can you highlight some of the key benefits for such collaboration? And what are some of the challenges that might prevent such, we might face, or the sector might face, and how we can overcome those challenges in order to reach the maximum collaboration level?
So thank you for having me. We don't have the whole day, so I'll try to be as brief as possible. But I thought I'd start by asking a question. So I looked and I found in 2021, someone went and downloaded all the papers on supply logistics chain, sustainable supply chains. That was 2,400 papers approximately. How many of them do you think mentioned humanitarian logistics? It's a question. I'm a professor, I ask questions.
You,
What is few, like 100, 200,
analysts.
less, like how less? The answer is
Tens.
15. So my point is, if we don't talk about such things, we're not actually going to have research on it, we're not going to be able to actually set agendas. And intersectoral research means getting private partnerships, talking to the government. I mean, we represent public policy, but bringing management. And I always think professors have this unique role. They take their research and explain it to classrooms. If I think of my almost 20 years of experience, I don't know how many students I've taught, but each one of them will go and work in a company and hopefully are senior managers. And that's a unique opportunity. It takes time, but we change mindsets. So I think that's the first most important thing of intersectoral research is creating awareness and maybe prioritizing or getting certain issues on the agenda. And with humanitarian logistics, which is about 60 to 80% of the cost of humanitarian aid, this is significant, right? This is huge. Now, where do I think we can get involved? The first one is identifying the problem. I think each of the panelists have highlighted with COVID, it was so difficult to understand from which angle we wanted to go and look at it. There was a health issue, but is it about mobilizing resources? And we already see when you look at product, there's issues of product standardization worldwide. This is a problem, modulars, there's research that can be done over there. There's question of actually production. We saw that at the end, because borders closed, we didn't have supplies. So it was about how quickly we can pivot production. We saw car manufacturers making ventilators, for example, or fashion houses making masks. So again, I think it's about getting the private sector and then understanding if you have to support humanitarian situations, how can you repurpose some of your excess production capacity to help us? We don't really do this, but this is something I think that should be on the agenda. Funding, coming from an academic point of view, academics have a mandate. We're teachers. We are not historically, we do research, but that's not our primary mandate. And this is really confusing for us because we have to do it on top of our teaching requirements. And there's a lot of work. So just even making sure that academics have the funding or even the time or even that you share the knowledge. Because very often, sometimes when we ask people, can we have a meeting, they think, it's an academic, it's a waste of 2 hours. Well, if we don't understand what's going on, we can't take it to the classroom and we cannot teach it. And if we cannot teach it, that crop of students who are graduating have no knowledge of what needs to be done. So I think, again, it's about really getting everyone involved in this humanitarian sector to give us the space. Usability of research, and I want to highlight this with one example. By the way, I'm Indian, so I talk very fast, so excuse me for that. But there's a fact that we keep saying, if you're prepared, the impact is 1:7. And I see that quite often. And I found this very interesting because it actually said when they went and looked at preparedness, for example, and I think they looked at Nepal and they looked at Haiti. In Nepal, it took them, I think, to prepare something like for 9 days. But when they did it in Haiti, it was almost 1 year. So I think preparedness is not the answer, really. We have known historically that crisis will come. We knew the pandemic was coming, we just don't know when, right? And when it comes, we don't know how to mobilize things because, especially in health, everything has a shelf life. I cannot keep it for 10 years. I cannot keep it for 20 years. I need them to make that decision of how much should I keep, and this is not easy. So I think it comes back to this thing of how can we do dynamic procurement, right? How can we go back to the ecosystem and think of all the eventualities and see who can modify what? And I think I want to highlight one more thing in terms of agenda setting because I'm very passionate about that. I love that we came out with vaccines, but vaccines are expensive. Right? I think pills are much more cheaper. And I feel now we've got pills for COVID, but the agenda initially all was really on finding a vaccine as quickly as possible. I'm glad we found one. But again, when I think about sustainability and cost, I think we need to figure out how we can do this a little bit better. By the way, feel free to disagree with me because maybe my research has already become obsolete. I did want to mention one more thing, which is the research pipeline. Now, very often when we do research, we start with basic research. So I think a lot of the models that are being especially implemented in supply chain came from the military, for example. That's where ops management came from. Now, basic research to applied research normally takes about 5 to 15 years. So we're really talking about investing in conceptual research. Applied research to commercial research takes anything from 2 to 5 years, right? So you see this time gap that's there, and I know historically also. So me as a professor doing research, it takes me about 2 to 3 years to get published in a journal. That's the process. By the time it gets into a textbook, so all of you who've studied bachelor's degree, master's degrees in a textbook, that information is already 15 to 20 years late, because it's a collection of so much of research from the past, right? So the best way to actually get the answers is from the horses now, maybe from the professors or from the people actually working on the line. So it's a complicated process. If we need to get more information out there, it needs to be evidence-based policy. It needs to be strong enough for us to take decision-making in the organizational workplace. We need to involve more academic researchers. And I do agree that we don't always speak very well. So it's very difficult to read some of the material we produce, and that's a translation problem of how we can make it more accessible. But again, I beg you all, just involve us in whichever way possible. And I'm thankful so much for you to give us this opportunity to speak.
It's our pleasure to have you from Medina. And thank you for highlighting an important issue about the lack of research in the sector. We really have this gap, and we as health logistics, we're working on this. And also, you mentioned a very important point, the access to information. Definitely, this will help in different aspects and different pillars. It's needed by all the partners and all the stakeholders. So now I guess we can go to questions. If anybody has any question from the audience or maybe from the chat. Thank you. We can start with our audience here in the room. Shihab, please.
It's not a question, actually. It's just a feedback that based on this panel, maybe any of the respective panelists can reply to me. I have a small experience in the humanitarian sector, honestly, compared to the panelists and the feedback, the experience that they have. I usually used to hear humanitarian coordination. It comes to my mind, and I think everyone else's, UN, NGOs. When a disaster happened, when an emergency happened, let's coordinate. So UN and NGOs. But what I can see now, and the next step should be of humanitarian coordination, is the F, E, I, B, P, and T. Facilitator, enabler, implementer, provider, and teacher. So we need the facilitator and the expertise. We need the enablers and logistic company and the private sector. We need the implementer, who are the NGOs who are implementing in the field. We need the provider, health provider, or any provider that they can provide as a supplier. We need the academic part. I mean, Joseph, the first thing he mentioned is that the lesson learned. I mean, who is best than the academics to go and dig into the past and see the lesson learned and try to implement and correct and advise the new people. Plus, once they see the past, they can help us in the future in terms of innovation. So they know the problem and they provide the solution for it where we can use for it. I believe moving forward, the coordination should be among those sectors, not only the UN and the NGOs, because each one has an added value part and expertise for a proper preparedness, for a proper response to emergencies. And it's not only about UN organizations or NGOs. Plus, of course, we have the donors part that should be always available to support. This is only my thoughts. Respective panelists, they can provide their feedback, either they agree, they do not agree. I hope they do not agree, which is fine with me. But anyway, it's just a thought that I need to share and with the audience and the panelists. And thank you for organizing this panel. Personally, my personal experience I had later academic when I did the diploma with health logistics as well. on the humanitarian logistics. Despite that we have an experience, still the academic part is very, very, very important to give you a wider look into what you are doing, to make you understand why this has been done this way and why you have to do it this way, and give you, of course, a better achievement in the final result. Thank you very much for your time.
Thank you, Jihad, for sharing your experience about the diploma. I guess now we'll check with the panelists if they agree with your point of view. But I would like to mention regarding the diploma, maybe also it was the idea of having participants from different NGOs that really helped in exchanging the experience, exchanging the knowledge. Each added his own or her own perspective. So that also brought a lot. Please, Mr. Joseph.
Thank you. Well, a couple of years ago, it's Mr. Tegay, no more than a couple of months ago, passed through IHC Dr. Pedro, the Director General of Aviation. And together we were discussing on his own previous visit, which happened 3 years ago. Well, anybody can open the dashboard of the International Humanitarian City, the Humanitarian Logistics Data Bank, is going to know that a few years ago, we used to have under the cluster of apps, maximum $4 or $5 million of medicine, medical supplies, equipment. If you open today, we are talking about something that is close to the $60–70 million. Which means that or we are extremely flexible because to jump and to get across the years this huge change is that we have been obliged to immediately intervene on the facilities, so get as much as possible space under temperature control, rebuilding fully the cold chain center, and this is something thanks to logistics, because together with them, this is what we did under the technical point of view. We got their own support, as well as for building up then semi-automated pit center. I don't have any doubt about the need of getting the presence of the academic institutions into the humanitarian field. The reason why I mentioned before this exponential increase of medical supplies into our stock, because automatically we need to change also in the management. We need most probably another level of professionals to take care about that stock. This is the reason why today, instead of to discuss humanitarian logistics into AFC, we are focused again together with the support of health logistics and the academic institutions on the health logistics. Preparedness for me remains a key. Of course, we can talk about preparedness at least under the point of view of international humanitarian city, prepositioning stocks. There is no doubt. Most probably we need to use better the network 10 humanitarian hubs that we mapped within IHC. We should use better those humanitarian hubs in order to get the proper level in each hub. Secondly, when you talk about preparedness, it's not only and exclusively to focus on the level of stocks. Recently, in responding to an interview, the question was that we should empower the local community. Well, this is the, let me say, the principle, but the very basic principle in emergency response. If I'm not able to prepare the local community, it's not absolutely us coming from 3,000, 4,000 kilometers far that we are going to save lives. Lives are saved by the local communities, or we are able to prepare the humanitarian community. Otherwise, forget it. So we can intervene in larger scale emergency. We will be always extremely helpful, but without forgetting that this is also part of the preparedness. Just to mention a couple of points on preparedness. So there is no doubt we need to look into action plan. We need to get the support of the academic institution because, yes, we are logisticians, but we are, let me say, that type of logisticians that are trying to solve the day-to-day issue, but we need to look really into very long-term plans. Sorry for that.
Sure, no, thank you. It's all about long-term thinking. I guess also Victoria Medina maybe can tell us more about strategic thinking and long-term mindset that we need to adapt in order to have to be prepared for possible solutions and how we need to build strategies to be able to respond.
Thank you. So I thought I would just share another fact. So again, when looking at humanitarian supply chain training, research-wise, I found 144 documents and only 12 focused on human resources. And I think what you said is so important because it's about last mile logistics, right? We can go to the edge of the country. We see this with Ukraine. You can go to Poland, but you cannot go inside maybe, and you actually need another creative way to go and deliver. And I think this becomes so interesting because I'm looking back at something like the polio campaigns in Pakistan, for example, and if the cold chain was not there, then you gave all those children polio and then you still had outbreaks of polio, right? So because you wasted the money and you didn't achieve anything. And then there was this trust issue where the population says, did you cause this disease because you gave me something and it obviously now my child is sick. So it's so complicated, I think, and I think this is why we need the training, and the training has to spill over, not just from the people, for example, managing it at the NGOs or anywhere else, but to the local population. So the question is, how do we create that resilience? And again, I think we need to work with policymakers in some of these cases because it's a question of quality and an emergency. What are you willing to do and how quickly are you able to pivot? I'll give you an example again in Germany, for example, because the laws are so particular. I think only doctors could initially give maybe vaccines or things like that. And this actually prevented them from scaling up in a way where maybe in US any pharmacist could give that or a nurse can give a vaccine. So I think these kind of policies need to go hand in hand with the humanitarian sector, which already has this tremendous knowledge of what kind of crises are there. You have that already in your historical knowledge database, and you know from experiences how you've coped, but we don't know what would we do on a large scale. So tomorrow we have global warming and all the waters rise, 60% of the cities are by the coast, then we're talking about a different kind of scenario. I think the answers are lying with the people who work in the humanitarian sector, but have we actually put it in a book that's easy to access and codified it? But I think not necessarily. It's all in someone's memory and we haven't captured it.
Yeah, totally. So we need to maintain this knowledge, to have the communication, and to be flexible on the different levels, from government, private sector to the NGOs. So let me ask questions from our audience online. This is to Mr. Brad from Ahmed Habash. As the biggest cargo shipper in world by volume in 2022, how does Kuna and Nagel perceive the different needs and demands of humanitarian logistics in comparison to commercial logistics? Is there really a difference in the way Kuna and Nagel handles those two sectors?
This is a very important topic, and Kuna Nagel has definitely made many decisions based on humanitarian. We don't just see humanitarian logistics as the movement of cargo to areas. We see the final patient as our end customer. What we have done quite successfully as partner, once again, I think everything comes down to partner. We talked about academia, we talk about the relationships of the NGOs, of the private sector, of the areas. And what we have done very successfully is being able to coordinate. We don't see humanitarian cargo as a different type of cargo. We still think that sustainability is important to have humanitarian cargo. We think that it should fly as booked. We think that it should move as planned. And we've got systems that allow for that. What we do, what I personally do believe is necessary is the conversations more often. So like I said earlier, that what I was trying to stress is we should speak sooner and we should speak often. We shouldn't wait until a solution is required to start looking at what solutions are available. If we look at the different countries as a crisis happens, they should be able to think about what needs to be done on the ground. Like Giuseppe said, they should be given a blueprint of what can be done, and then they should be executing what is close to them. I think what does happen quite often is everybody does the same thing, and they do it in separate boardrooms, and then when they come together, they take the best ideas of the lot, whereas I think that a more planned coordination, we'd be able to have blueprints put in place, and then we just add areas of expertise or excellence, which really just close everything down. But to answer the question, there is no difference for us. It is as important as any other content.
Thank you, Bradley. So another question to Mike, Mr. Mike. How was COVID-19 pandemic different in supply chain terms and challenges to the Ebola pandemic in West Africa? Why were supply chains not adapted globally in a manner to sustain such pandemics? And what does an NGO like MSF need in order to adapt to future ones in the coming years or decades?
I mean, the main difference between Ebola and COVID is that Ebola was localized. Ebola was very localized. I mean, it was, if you want to look at it in terms of disruption of flows and disruption of circuits and chains, it was a mini COVID pandemic from that aspect. So that's one main issue. So it was in a way much easier to circumvent than what you had with COVID, which was a global situation. That's one aspect. The second main difference is that unfortunately Ebola did not speak to as many people as it spoke to, as COVID spoke to everybody. I mean, I guess we were all, regardless of where we were on the planet, concerned by COVID, and it affected us and it hit us all. And some people unfortunately lost loved ones. Some witnessed, difficult situation. I mean, this was a dodgy virus. Let's be honest. And this is not for me. Its strength was its weakness, and that's the third big difference with Ebola. You get Ebola, you're basically looking into, I'm going to simplify, of course, because the situation medically at least is a bit more complex than that, but you're looking into dignifying the last moments of the patient, because it's very difficult to be cured from Ebola. Let me put it this way. I'm simplifying, and I don't want to do justice to, not doing justice to how complex it is, but there is a huge difference there. And because you know that how deadly that virus can be, then there's a lot of behaviors that are almost granted and that are almost systematic, and that people take it much more seriously. What we saw, unfortunately, around the planet with COVID is different levels of seriousness in looking at it. So those are for me the main three differences between Ebola and between COVID as a pandemic. Now, what do we need today to adapt? I would say, I'm going to be a bit provocative here, maybe go a bit against the stream. We just need people. I've been involved in humanitarian response for almost 20 years. I think what makes a response or what defeats it is the people that are there. And by that, I mean, as individuals, how much knowledge we gather, how much experience we have, how many terrains we've been on, how many different type of emergencies that we've handled or we've been handling, because this is where it becomes almost like a second nature to go sit with Kunanagal, for instance, and discuss very specifically and very quickly what we want, to approach the academic sphere, maybe at a different timing, of course, with very specific requests and very specific needs. I always get a bit too weary about coordinating for the sake of it, and when the conversation becomes a bit too theoretical. Now, it's a bit of a contradiction here, because you can't really have that conversation when you're in the thick of it. But then at the end of the day, it's really the people that I've dealt with and the people that I've worked with that have made or that have changed that. So, and the rest will follow. I will finish by saying, do I think that we will have learned globally, of course I'm speaking, any lessons from the disruption of all the flow that we saw? I don't have a doubt in my mind that we've learned nothing and that we will repeat the same things globally. I am talking about. However, where we will be much stronger is that as specific individuals who were involved in those crises, who were able then to restitute the experience to their respective team members, organization, circles with whom we are discussing, circles with whom we are trying to progress and to evolve. This is where the difference is going to come from.
Yeah.
I'm sorry to be a bit bleak,
No,
but
I think this panel is part of the effort to make sure we highlight those lessons learned, those challenges, and to make sure we learn something and we're building on the knowledge and experience, definitely. So I guess we don't have additional questions online. Maybe I'll check with the audience on the room. Dina, please.
I think we have time for just one more question. And I want to address this question to any of you. And it's, we talk about capacity building as a component of preparedness. But when we talk about capacity building, specifically in the humanitarian sector, what can the workforce in the humanitarian sector learn from the skills in the private sector? What do we find is missing in responding to future pandemics?
Yes, that's a very, very important question. True that we see a world in a global perspective. You see the challenges were different in different areas. True that UAE we have seen a scenario, India a different scenario, US, Europe and all different scenarios. But luckily, the pandemic was initially not that hit in Africa. Imagine if it was the same thing, what would have been the fate? So even something gone wrong in some countries, it is because of their carelessness or irresponsibility of the people. Otherwise, the death would have been much lesser than that. So they had the knowledge, but they were arrogant. So the other side, they had no knowledge, no capacity building, so they could not even transfer that knowledge to them or to make the society. So capacity building is playing a major role. One example I'll just tell you. The recent past, representing Aster volunteers, I've been to a couple of countries, you know, the Ethiopia, Sudan, Yemen and all. Very unfortunate to see that sad fate, you know. The doctors there also require a support. It is not something when the pandemic hit. It is to prepare them even to meet their daily healthcare needs. Should we do some wrong? Then, if that we are able to do it, I'm sure that if a pandemic hits, they will be easily to overcome that, or they will have their own capacity. So, yes, I agree, the academics plays a major role. Like, you know, so we released one white paper, but again, we see that it's published 1 year back. What is the updates? Again, someone has to continue with that one, and this information need to be taken to the places where that educational gap is not there, or even sort of an engaging the community who is having and who is not having, building them together at least somewhere, you know, we build it. Otherwise, don't take that the COVID will have to just take it as a what you call a catalyst only. So it helps in building future better, so that we learn. The lesson learned is for the betterment of tomorrow. If we are able to collaborate better, implement it better, and look at an angle of the sustainability. So if the UN goal, you know, the partnership better, probably we all work together. There are, as you rightly mentioned, large number of NGOs. They all can also add value. Government can add value, private can add value. Only if we work in a collaborative way, work with one goal, or any of the goals of UN sustainability goal, because 2030 it's going to expire. It's a time for a longer view or a longer strategic vision and this thing. If not, we are not doing now in 2022. So 8 years ahead, you know, when are we going to do it? So if healthcare for all is a goal, then we should again reinforce the 17th goal. Work in partnership. Let's look at the sustainability and see that we are making a different world so that the world is better.
Dr. Melody, maybe you have something to add?
Yes, so you were asking private sector, what can the non-profit learn from private sector? The assumption is the private sector does it better than the non-profit, but I've taught both. I mean, I teach across both fields. I think the biggest challenge is really a mindset change. One is focus on values. So what is your values? In a crisis, if you don't have a North Star, everything goes literally, I would like to say to shit, excuse the language. So it really depends on every organization having that value embedded in their thinking in each employee, because that is the North Star. The second thing is systems thinking. In a crisis, everything goes out of whack. I think if you think of it very narrow, that's where this collaborativeness thing. You define a problem too narrowly, you're going to have a problem. If you think airplanes and tomorrow you have a volcano explode, airplanes can't go, what do you do? So the systems thinking is that ability to connect the dots. And I think those two are the most critical thing. The knowledge you will find, if you are good at networking, if you know how to reach the right people, you will find the knowledge. Nothing can teach you at that time of crisis what's there. There's no playbook there. But the mindset change, I think this is what true academia can actually bring, is change mindsets.
Thank you. So yeah, we need to change the mindset, and maybe you highlighted an important issue of the research, how time it takes, and maybe then what we have is not valid anymore. So maybe we need to create this disruption in research, the way the vaccination manufacturing change the way they work. Yeah, please.
If I was a student, I'd be really upset to know that I'm being taught something that might be not valid. Okay, so what are the, maybe you guys need some sort of disruption in terms of how they teach.
Let me just re-qualify that. I don't think old knowledge is bad. I just think contextually it needs to be adapted. So a lot of the problems you face today are not new, because human beings have not evolved significantly since long back ago. Wherever human beings are, they have the same problem, whether it's war or whether it's, living in the wrong place next to the volcano, even though the volcano exploded 15 times, you still go and stay there. Human beings have not evolved, but the context changes. So I think it's not that the information is obsolete. I think the context changes, and that is why the mindset change is so important. Please come and study with us.
Although I praise your initiative and proactivity to be able to connect with the humanitarian city, for example, you're always welcome, and maybe this is the right platform to invite all the NGOs to open doors to the academic sector to come and see and try to get involved in the knowledge that is there, where the NGOs cannot really or don't have time to try to share it with the others. So open doors for such institutions to be able to take this knowledge and spread it out and do awareness. Please.
Yeah, I think there's one aspect here, and a bit in line with your question, on the corporate sector and the non-for-profit sector. I think we were an extremely complementary panel here, but there might be maybe one person missing or one table missing, which is the one of applied research and innovation. Okay. And I think that, again, when I think private sector, my go-to is that bit, because you were talking about vaccines and pills and all. What I'm really interested in today is, are we going to be finally able to pioneer vaccines that don't require temperature control? Because that would be an amazing game changer for everything that we're trying to do. We saw it with the vaccine for the first vaccines that came out for the pandemic, for COVID. We needed very specific temperature control that even the usual vaccination campaigns could not provide, et cetera, et cetera. If you look at it also from a historical perspective, a lot of the humanitarian logistics was based on military logistics. And this was also at a moment in time where the complexity of our sector was what it was, and that the top-notch research or means that would be available that could be transformed in a way were in that sector. And thankfully, we have evolved tremendously. We have evolved tremendously from that. So today, when I think private sector, the debate or the discussion or the dialogue that I want to have is to really explain what I need and what I don't have today. And this is where that applied research and that innovation kicks in. And this is, in my opinion, the best type of collaboration that we are able to have. Whether it's on, again, I was taking an example of vaccines with temperature control, whether will it be on something that will facilitate the quality control, or will it be PPE in that case that will be easier to assess or to address or produced in a different way, et cetera, et cetera. And I think that, and I'll finish with that, it comes down to two aspects, basically. Us as the humanitarian sector really taking the time and the effort to explain, because we have become a whole professional sector with its complexity, with its issues, with its limitations, and this is one of our limitations. And I don't have that technology and that know-how that you would have in the private sector sometimes, because there's very specific added value there. And it's my responsibility to go forward and to explain and to say, look, this is what I need. And at the same time, to rid ourselves, absolutely, you're absolutely right, from the assumption that maybe the private sector does it better, but to explain to the private sector, to have the private sector listen. And I think that this is where you really build a dialogue, to have them both together. As we go and more, I think this will be really the key partnerships between our two sectors. And I couldn't stress enough the importance of innovation and applied research. We're not looking to revolutionize the world, we're just looking into very specific application, most of the time of existing techniques or technologies or science that's available, and how do we apply it?
If I may, Mario, you are right. You know, if I should look at how it's being conceived, the international humanitarian system is exactly on this model. From one side, you have the humanitarian community, and from the other side, we have together with us what manufacturers of humanitarian aid, we have the excellence of the statisticians and so on and so on. So means that combining together, because we, as humanitarians, and I'm the humanitarian worker, I know perfectly what is happening in the field, but I don't have absolutely any clue on how to get solutions for my challenges. And this is where we need for sure the private sector. The point is another one. Unfortunately, I'm coming from the UN, so I know extremely well. You have a certain point of balance. And this has been established by in particular by the UN system, sometimes even in the public sector and so on and so on, where the humanitarians and the private sector or commercial companies and so on should not talk anymore together, because we have to do transparent procurement, we need to respect certain rules and regulations, or even worse. Sometimes people are thinking about corruption and so on and so on. Now, let's just be honest. If we are not able to break this wall and try to get really a transparent dialogue between the humanitarian community and the private sector, the commercial companies, and so on and so on, most probably in another 30 years or 35, I'm going to continue to see in the field exactly the same line items, the same solutions, and so on and so on. So, if I'm not talking today with probably when I should talk, this is the point. Or with us, that is
So we need to make sure that we're communicating and talking together, also to have transparency and make sure everything is clear and there's no hidden agendas. Yeah, I guess we have another question also from Ahmed to Dr. Medina. So Ahmed is asking, both humanitarian organizations and education institutions face their biggest challenge in funding terms. Is there a way for both to work together in such a manner that would enable them to simultaneously tackle the challenge? I guess you said it indirectly, that we need to have the academia more involved. We need to deliver the knowledge, what's going on, to make people more aware and more educated, and then maybe.
I just want to mention this in terms of funding and time. I briefly touched on that. But in our research career, most of our time is spent face-to-face with students. I think students would be very upset if we said, "Hi, I'm going for a panel and I'm skipping classes." Maybe they'd be happy, but the ministry would be upset with that. So everything that we do is an added and above. So this raises a little bit of a complexity in terms of university will then ask for funding. So we need to generate the funds itself, and then we need to find the time to do the extra things. So this becomes really hard. Where do you go and raise funds for doing research? So very often we do passion projects. I think Dr. Emmanuel is here. Together we started case study books in 2010. We did we wrote 88 cases on the Middle East region because we realized when we were teaching here, there was no examples of how companies behaved here. Those 88 cases, each case would have been 10 interviews, hours and hours of work, many drafts. We did it for free. So it's a huge amount of work. I think most people would look at us and say, are you crazy? But we were passionate about that. And that is something we think is our legacy and contribution to the region. So I think if we need to get more academics, we do need to address the issue of funding. We do need to address the issue of time. And this is something that if you lobby with universities and they realize the importance of that, then they will again grant us the time to work on these projects at your convenience, and we would not be a pain in the neck and take away from critical moments. I can see all of these people say, oh no, she's going to harass me. No, we're very, very good. We have very good impressions of the people we work with.
So again, yeah, it's awareness and opening doors and communicating. Maybe we have some last words from you. Bradley, I would like to hear from you more about how did you see the pandemic catalyze any advances in technologies and application, and how do you envision the role of the private sector in the future of the health supply chain?
So I'd like to touch on the second part of that question first of all. I agree 100% with you. I think it's very easy to sit back after the pandemic rush through the earth and not applaud the successes that we had. That it was really to have manufactured vaccines in a time frame, to have the distribution done the way that it was done. And what I think we need to do is, as business, as private, as NGOs, as suppliers to NGOs, as a community that wants a better world, we need to sit back, have a look at what did go right, and remember it. I think it's very easy to forget it, like you said, Mario. It's very easy to sit back and think, well, that could have been done better. But what we should be discussing is what did go well and how we can shorten the time that it took in the future. Because I don't know a single person that could tell you that it went smooth, but definitely nobody would have said that it didn't go well at all. I think the place of private in that discussion is definitely part of the solution. The generation that comes next, they're going to be the real innovators. They're the ones that think outside the box. They're the ones that came up with the ideas. And I think the seed is planted in academia, and it flourishes through the experience of the people in the panel, and that is how private and NGOs can forward the future.
Proceed. Thank you. So we're done with the questions. Maybe we can have one small remark from each one of the panelists. Maybe just one last remark.
So because I'm coming from academia, I just want to add one point. Like the vaccines, we've spoken a lot about it. The genesis of the vaccine began with basic research, which was 45 years back ago. Started with governments investing money in 3 different technologies, nanotechnology, something in chemistry, biochemistry, and they all came together, thankfully, in 2019, which was good for us. But the investment in research is a long-term process. It's not just the 1-year applied research. So I think for us, we need to really look ahead and say what will be happening 10, 15 years and what we should start working on right now. And I think that will be the pivotal movement, because we need to lobby with governments to put that money in now. So in 10, 20 years, we will have solutions that are out of the box. Otherwise, we're just doing incremental innovations. And I think that's where the richness will come from these discussions, is asking, what do you think 20 years is going to be the next big thing? And how can we think out of the box for that?
Thank you, Dr. Mr. Jalil, please.
Yeah, so when you look at the healthcare delivery of the logistics challenges as a perspective, so this is a transition phase. So we, as I told you, the COVID taught us some lessons. So when only the COVID came, the China remarks decided to know that the logistics of East China. So, but imagine China invested by 1980, started invested in the infrastructure, and want to reach at a stage they control the world in the logistics and technology supports and all. So tomorrow, if something to make it independent or something, so it could be some place maybe the service side, it could be some places the technology, it could be some places the other intellectual capacity or the materials. We should see that such hubs are generated in different pockets and looking at the challenges. It can be natural catastrophe can happen, or it can be a war, it can be some other issues, or even a pandemic tomorrow. So how to overcome? I was very impressed listening to the CEO talking last time. The IHC want to have extended to different countries and to have some spoke models where like it is, instead of having everything centralized, the same expertise can be leveraged to separate places and then work together so that the response time can be reduced. Also, what I suggest is also there are a lot of capacity we already built to overcome this crisis. So that capacity, whether it's a technology driven, earlier it was unimaginable to see a doctor through a technology. Now, if you are not able to leverage the technology or the capacity you are built for the betterment of the society and driving into that situations, so we are not going to leverage what we learn from this one. So there, like again, we should not work like in different isolations and or even the data, the big data we talk about it. Even the COVID brought a lot of data, but still, where is the data sitting? We may be knowing where is it hit and how many deaths or here, there. And is it that what we are looking in the long run? So it should be way of an integrated tomorrow where everybody plays a role, the government, the NGOs, the private, the facilitators. So then work together to have a better solution so that what we learn can be applied. So tomorrow, even a double time effective pandemic comes in, we'll be able to tide over with minimum damage.
Let's hope so. Thank you, Mr. Jali. Mr. Manu, tell us what's your last
let me go a bit more transversally to wrap it up. I just think we need more of this. We need more of this. We need more of this collective discussion. I think we would have a lot of bilaterals in normal times, but it's that collective discussion that I think will really bring us forward. I'm a pragmatic. I've always been pragmatic, and I think that by default we will revert towards those bilateral because we have a commercial relationship together, because we happen to be working under the same umbrella, etc., etc., etc. But I think it's those collective gatherings that really help us advance and really help us get further. And I think you said, Bradley, an expression that was really good was the end of the pandemic rush. And I think it's always for us between two rushes. As much as we can gather and make use of those in between phases is really how we'll be able to progress, because this is the time that we have to then take an outcome of a discussion like this one back. And what I'm taking back is not necessarily a particular intervention or particular point, that it's really the collective exchange, and it gives me a panoramic view that, again, by default, I will not have if it's just Bradley and myself talking, or if it's just Giuseppe and myself talking. So we need more of that, maybe one or two more type of interlocutors or representatives or something, but let's have more of that.
No, hopefully this will be coming soon. And Mr. Bradley, you would like to add anything else?
Just for me, finally, what I would like to see is exactly the same. So more planning, more partnerships, and more communication and innovation. Because if we get those three things, it will definitely shorten the time span for any crisis that might happen.
Yeah.
2 points. One is that for the next emergency, going forward, that we are going to wake up and say what we have to do. So no lessons learned. The second is that the humanitarian space is quite huge. I don't know how can we measure the humanitarian space, but for sure it's not property of the humanitarian professionals. For sure, always welcome the NGOs, I welcome the private sector, I welcome the foundations, the philanthropists, is a huge space. And what is happening today is that also those components of the society are drastically changing their own mindset. Now they want to be part of the humanitarian action. They are not anymore passive donors coming there and saying, okay, what we need you need a couple of $1 million here, a couple of $1 million too. No, no, doesn't work anymore this way. Here, you can learn even from Bradley, so they are extremely active in the humanitarian sector. So the Nugget Foundation, I can bring you a lot of examples. So we have to be extremely careful. They want to be the professional of the humanitarian action. So just keep in mind that the humanitarian space more and more is going to be well populated also by those that we don't consider today professional, but de facto are professional.
Thank you, Mr. Joseph. Unfortunately, we need to close our session today. I would like to thank the panelists for their time and the very insightful knowledge. Thank you for being with us today. And we hope that it will be the start of a series of panels and discussions around this topic, focusing on the continuous learning, the knowledge sharing, the partnerships, the digitalization, and creating ecosystems in order to as a way to future-proof our health systems and to be more prepared and to respond as efficient as possible. Thank you for our audience online and for our audience in the room. This will be the end of our session. Thank you.
Thank you.